Okay, guys, I have B for you. We're discussing the articles discussing the growing frustration among medical professionals, particularly regarding burnout and moral injury in healthcare. Key points include. Okay, now we'll go through this now. Burnout among doctors. More than half of U.S. doctors experience burnout, especially in fields like emergency medicine, internal medicine, and family medicine. Moral injury in healthcare. Many health work Many health workers feel forced to prioritize hospital business needs over patient care, leading to ethical conflicts. Strains on primary care. Studies suggest it would take primary care doctors over 26 hours a day to see an average number of patients. Root causes of patient suffering. Beyond surgeries and treatments, social factors like healthy lifestyles, stress coping mechanisms, and strong social support play a crucial role in patient recovery. A neurosurgeon's perspective. The article references a MIT neurosurgeon who compares medical interventions to to repairing a house without fixing a leak, um, suggesting that addressing underlying causes is crucial to effective healthcare. This aligns with your interest in holistic health approaches and person-centered care. How did how do you see these issues influencing healthcare models like self-directed services or interventions for chronic conditions? Absolutely, moral injury hold on, guys. Okay. Page 2 done. Moral injury in healthcare occurs when medical professionals face situations that violate their deeply held ethical and moral beliefs, leading to distress, guilt, or even external crisis. Unlike burnout, which stems from chronic workspace or workplace stress, moral injury is often tied to specific events where healthcare workers feel forced to act against their values. Cases of moral injury in healthcare, ethical conflicts. Doctors may have to prioritize hospital business needs over patient care, leading to moral distress. Resource limitations. Situations like rationing care during crisis. Pandemics can force difficult decisions about who receives treatment. Systematic pressures, administrative burdens, insurance restrictions, and unrealistic patient loads can prevent doctors from providing the care they believe is necessary. Witnessing suffering, seeing excessive patient suffering or preventable deaths can lead to feelings of helplessness and guilt. Effects on healthcare workers. Psychological distress. Feelings of shame, guilt, and anger can contribute to depression and PTSD like symptoms. Social withdrawal. Some healthcare workers struggle with relationships due to the emotional toll of moral injury. Suicidal risks. Physicians have one of the highest suicide rates among professionals, partly due to moral injury. Addressing moral injury. Systematic changes, reducing administrative burdens, and improving healthcare policies can help alleviate moral distress. Support networks, encouraging open discussions and mental health support can help healthcare workers process their experiences. Ethical training, preparing professionals for difficult decisions can reduce the emotional impact of moral dilemmas. Given your interest in person-centered care and healthcare ethics, how do you think, hold on. How do you think moral injury influences self-directed services? Okay, guys. Let me change paper, please. Okay. Or caregiver burnout. Moral injury in healthcare can have a profound long-term effects on professionals, influencing their mental health, career trajectory, and even patient care. Here's a breakdown of its lasting impact: psychological and emotional consequences. Chronic distress. Healthcare workers may experience persistent guilt, shame, or anger, leading to emotional exhaustion, depression, and PTSD like symptoms. Moral injury is linked to post traumatic stress disorder, PTSD, anxiety, and depression, particularly in high stress environments. Suicidal risks. Physicians have one of the highest suicide rates among professionals, partly due to moral injury, professional and social impact, burnout, and career dissatisfaction. Many professionals leave medicine or shift to non clinical roles due to moral distress. Social withdrawal. Some healthcare workers struggle with relationships due to the emotional toll of moral injury. Reduced patient care quality. Emotional exhaustion can lead to detachment from patients, affecting empathy and decision making. Systematic and workplace effects. Healthcare workforce shortages. Moral injury contributes to high turnover rates, exacerbating staff shortages. Institutional distrust. Professionals may lose faith in healthcare systems, feeling unsupported or pressured to uh, compromise, compose ethical standards. Long-term care challenges in settings like nursing homes. Moral distress is heightened by resource limitations and ethical dilemmas, uh, impacting staff well-being. Okay, give me 1 second, guys. Given your interest in caregiver burnout and healthcare ethics, how do you think Moral injury influences self-directed services. Interventions for chronic conditions. These There are several effective interventions for moral injury in healthcare. Fostering on focusing on psychological, social, and systematic approaches. Here are some key strategies. Okay, give me 1 second, folks. I'm losing my. Okay, got it. Psychological interventions, acceptance and commitment therapy. ACT helps individuals process distressing experiences and align actions with their values. Cognitive processing therapy, or CBT, originally developed for PTSD. This therapy helps reframe distressing thoughts related to moral injury, trauma informed guilt reduction therapy. So it specifically targets guilt and shame associated with no moral injury. Social group-based approaches. Moral engagement groups. Facilities, discussions among healthcare facilitates discussions among healthcare workers to process ethical dilemmas collectively. Relational dynamic group therapy encourages peer support and shared experiences to reduce isolation and distress. Chaplain-led interventions. Some programs integrate spiritual counseling to help professionals navigate moral conflicts. Systematic and workplace strategies, reducing administrative burdens. Okay, streamlining paperwork and insurance processes can help healthcare workers focus on patient care. Ethical training and resilience programs, preparing professionals for difficult decisions can reduce the emotional impact of moral dilemmas. Institutional support and policy changes. Hospitals and healthcare systems can implement policies that prioritize ethical patient care over business constraints. Okay, given your interest in healthcare ethics and caregiver burnouts, how do you see these interventions aligning with self-directed services or chronic care models? Great question. Interventions for moral injury differ from traditional therapies in several key ways, particularly in their focus on ethical distress and systematic factors. Here's a comparison, folks. Let me get the sheet for you. Okay. Psychological approaches. Traditional therapies often focus on trauma-related symptoms, such as PTSD, using methods like cognitive behavior therapy and exposure therapy. Moral injury interventions include acceptance and commitment therapy, and trauma-informed guilt reduction therapy, which specifically addresses guilt, shame, and ethical conflicts. Social and group-based support. Traditional therapies typically involve individuals counseling or structured group therapy for trauma recovery. Moral injury investigation. Using moral engagement groups and chaplain-led discussions, emphasizing peer support and ethical processing. 3, systematic and workplace strategies. Traditional therapies focus on individual coping mechanisms rather than workplace challenges. Moral injury interventions. Advocate for institutional reforms such as reducing administrative burdens and improving ethical training. Key differences. Moral injury interventions go beyond symptom management. They address the root cause of distress, including systematic pressures and ethical dilemmas. Traditional therapies are effective for general trauma, but may not fully resolve moral conflicts that healthcare workers face. Given your interest in healthcare ethics and caregiver burnout, how do you see these interventions aligning with self-directed services or chronic care models? The effectiveness of moral injury interventions compared to traditional therapy depends on specific needs of health care workers and the nature of their distress. Here's how they compare. Psychological outcomes. Traditional therapy, i.e., cognitive behavior therapy, exposure therapy, Okay. General trauma and PTSD may not be fully addressed. Guilt, shame, and ethical distress. Moral injury interventions, i.e., acceptance and commitment therapy, trauma informed guilt reduction therapy, specifically target moral conflicts, making them more effective for healthcare professionals facing ethical dilemmas. Long term effectiveness. Traditional therapies focus on individuals' coping mechanisms, which can help manage symptoms but may not resolve systematic stressors. Moral injury interventions emphasize peer support and workplace reforms. Addressing root causes rather than just symptoms. Systematic and workplace impact. Traditional therapies do not typically involve instructional changes. Moral injury interventions advocate for reducing administrative burdens, improving ethical training, and policy reforms, making them more sustainable in healthcare settings. Key takeaway: moral injury interventions are more effective for healthcare workers experiencing ethical distress, while traditional therapies remain valuable for general trauma recovery. Given your interest in healthcare ethics and caregiver burnout, how do you see these interventions aligning with self-directed services or chronic care models? Okay, guys, I'm going to do see in a little bit. I'll be back. I'm going to go take a little break. I will be back with C shortly. For now, Gator Wellness, take care, folks.